Namaste students, myself Dr. Komal, Assistant Professor, Department of Komal, Faculty of Ayurvedic Science, ज्योति विद्यापीठ विमेंस यूनिवर्सिटी जयपुर राजस्थान। स्टूडेंट्स, आज की क्लास में हम पढ़ेंगे जेनेटिक डिसऑर्डर्स के बारे में। सो इन जेनेटिक डिसऑर्डर्स वी इंक्लूडिंग सम डिजीजेस लाइक डाउन सिंड्रोम, टर्नर सिंड्रोम्स, मस्कुलर डिस्ट्रोफी, sickle cell anemia, thalassemia, and juvenile diabetes. So let's start with Down syndrome. Down syndrome is a congenital disorders arising from the chromosomal defect, causing intellectual impairment and physical abnormalities, including short statures and a broad facial profile. It is arise from the defect involving chromosome 21. So type is Down syndrome types is trisomy 21, translocation, mosaicism. So first type is trisomy 21. It is the most common type of Down syndrome. 95% occurs when there is a 3 rather than 2 number 21 chromosomes present in every cell of the body. Instead of usually 46 chromosomes, a person with Down syndrome has 47. It is additional genetic materials that alter the course of development and causes the characteristics associated with the syndromes. So, second form is translocation. 4% of cases of all Down syndromes, parts of chromosome 21 break off during cell division and attach of another chromosomes. Typically, chromosome 14, while the total number of chromosomes in the cells within the 46. The presence of extra part of chromosome 21 causes the characteristics of Down syndrome. Mosaicism. 1% of all cases of Down syndrome occurs when non-disjunctions of chromosome 21 take places in one, but not all, of the initial cell division after fertilization. When this occurs, there is a mixture of two types of cells, some containing the usually 46 chromosomes and other containing 47. So, what is the sign and symptoms? Short statures, flat facial features, small head, ear, short neck, bulging tongue, and poor muscle tone. Impulsive behavior, poor judgment, short attention span, slow learning capacity. Complications. Here is some complications like loss of hearing, poor vision, cataract, congenital heart defect, dislocation of hip joint, and leukemia, chronic constipation always may be there, and congenital heart defect like patent ductus arteriosus may be occur. So, treatment. What is the treatment of Down syndrome? So, there is a therapy to improve sensory motor and social language and cognitive talks. And now Turner syndrome. Turner syndrome is a chronic disorder that affects only females. So it's occur when one of X chromosome, like sex chromosome, is partially or completely missing. So typically, classically Turner syndrome and mosaic Turner syndrome types is the two subdivisions of Turner syndrome. So classical Turner syndromes is a one X chromosome is completely missing. It affects about half of all people with Turner syndromes. And mosaic Turner syndrome is also known as mosaicism or Turner mosaicism. Abnormalities occur only in X chromosome of some of the body cells. So, sign and symptom is that during intrauterine period, thick neck tissue, cystic hygroma, and low weight. And during infancy period, short stature, delayed growth, lack of ovarian development, broad chest with widely spread nipples, low set ears, drooping eyelids, cubitus vulgus, and reduced birth weight. So, what is the diagnosis of Turner syndrome? It is the first diagnostic tool is ultrasound, amniocentesis, and chronic villus sampling. Serious chronic villus sampling. It's the most important type or investigations type of investigation in Turner syndrome. So treatment is, there is no cure for Turner syndrome. Treatment focuses to reduce symptoms and complications. Short stretches, administrations, growth hormone along with androgens. Lack of ovarian development, estrogen replacement therapy to help with development, and psychological counseling. And the next third disease of genetic disorder is muscular dystrophy. So muscular dystrophy, it is a group of disease that cause progressive weakness and loss of muscle mass in the muscular dystrophy. Abnormal genes like gene mutation and interferes with the production of protein which are needed to form healthy tissue or healthy muscles. So if there is any kind of weakness or any kind of protein deficiency, so muscular dystrophy may be there. So what is the types of muscular dystrophy? So dystrophy is the four type. First is myotonic muscular dystrophy, second is Duchenne muscular dystrophy, third is Baker muscular dystrophy, and fourth is congenital muscular dystrophy. So myotonic muscular dystrophy is commonly appear in early childhood to adulthood, prolonged spasm or stiffness in muscles, worsen in cold temperature, and affects its effect in ANS, CNS, GI tract. Duchenne muscular dystrophy is called DMD. It's a very common type of muscular dystrophy. It's commonly found in any muscular dystrophy types. So, most common form of muscular dystrophy in children appear only in male between the age group of 2 to 6 years. Muscle weakness or wasting may be there. Arms, legs, the spine become progressively deformed. Then third type is Baker muscular dystrophy, that is BMD. Similar like DMD, milder symptoms and slower progressions. Appears between the age of 2 to 25 years. Third is congenital muscular dystrophy. Congenital muscular dystrophy present from birth. From birth, congenital muscular dystrophy may be present, and it also has slow progression, and symptoms may be similar to DMD. Shortening, shrinking of muscles, and joint problems also may be there. So, what is the general symptoms of muscular dystrophy? We are discussing about four types of muscular dystrophy, and now we will discuss about what is the general symptoms of muscular dystrophy. So, general symptoms is muscle wasting, weakness of muscles, difficulty in climbing chairs, and frequent tripling or falling, inability to walk and stand, tip-top walking, pain in leg, facial weakness, inability to close the eyes. And diagnosis is genetic blood test, muscular biopsy, and EMG, electromyogram. Here is some treatment and supports, like there is yet no known cure of muscular dystrophy. Uh, Very important muscular dystrophy treatment is physical therapy or physiotherapy. It's very important. Medications. So medications is also helpful in DMD. Then nutrition and psychological counseling also must be there and should be doing for the children who had muscular dystrophy, and personal caretaker may be included for the DMD. And the fourth is sickle cell anemia. So what is sickle cell anemia? Sickle cell anemia is a type of anemia. So sickle cell anemia is a genetic disorder in which body produce abnormal shape RBC which slow down the blood flow and are unable to carry adequate oxygen. The RBCs are crescent and sickle shaped, hence the name sickle cell anemia. Causes: sickle cell anemia cause is idiopathic, and other words is genetic. So what is the symptoms? Symptoms is like first symptoms of sickle cell anemia is for the same as name, anemia. Anemia patients has color pallor, and he or she had fatigues, yellowish skin, eye and mouth, yellowish skin, eyes and mouth, periodic episodes in the pain of abdomen, chest and joints, hand foot syndrome, frequent infections, delayed growth, visions problem, and fever. Complications: sickle cell anemia complications is stroke, acute chest syndrome, organ damage, blindness, and skin ulcers. So prevention of medications, prevention of complications here: sufficient water intake, avoid too hot or too cold water, avoid high altitude like flying mountain, etc. Avoid place with low oxygen level, and avoid activity which may cause low oxygen level. So it is important to avoid some things that is provide or that is build up complications in sickle cell anemia. So it is important to keep in mind. Do and do's is very important in sickle cell anemia. So what is the treatment protocol? Treatment or management is very important in sickle cell anemia. So that is blood transfusion, bone marrow transplantation, gene therapy. Gene therapy is also important. Oxygen supplements and analgesics for pain management, and antibiotic for infections. Next is thalassemia. Thalassemia is also a type of anemia. So what is thalassemia? It is an inherited blood disorder characterized by abnormal hemoglobin production, increased destructions of RBC leading to anemia. So what is the type? Types is beta thalassemia, alpha thalassemia, and thalassemia minor. Three forms are three forms of thalassemia: beta thalassemia, alpha thalassemia, and thalassemia minor. So what is beta thalassemia? Thalassemia caused by change in gene of beta globin, component of hemoglobin, inherited from both parents, and usually causes severe anemia. Alpha thalassemia is caused by changes in gene of alpha globin, component of hemoglobin. So it's a quite difference in beta thalassemia and alpha thalassemia. Beta thalassemia uh, gene changes in beta globin component, and alpha gene changes in alpha globin component. Thalassemia minor is inherited from one parent only, either alpha or beta thalassemia minor, and causes minor anemia. Some symptoms is a pallor, slight icterus, enlarged abdomen, splenomegaly, growth retardation, infections, paralysis, bone deformity, irritability, dark color urine, and abdominal distensions may be present. So it is important to know what is thalassemia and its type. So, what is the diagnosis of thalassemia? So, diagnosis is bone marrow examination, serum electrolytes, serum iron, and CBC. Treatment is blood transfusion, bone marrow transplantation, corticosteroid, vitamin and minerals supplementations like ascorbic acid, folic acid, iron, etc. Antipyretic and analgesics, surgery like removal of spleen, gallbladder if required. So it is important surgery in thalassemia if spleen or gallbladder is not there. And next is juvenile diabetes. So what is juvenile diabetes? It is also known as type 1 diabetes or genetic dependent diabetes. It is chronic autoimmune disease in which the body own immune systems destroy the beta cells of islets of pancreas or isolate of Langerhans of pancreas, which result is very less or no production of insulin. So what is the causes of juvenile diabetes is exact causes unknown, and possible causes is genetic inheritance, low immunity, and viral exposure. So some kinds of symptoms may be there. So symptom is like juvenile diabetes patients have extreme weakness, fatigue, and irritability, extreme dehydration, thirst. Like it's a symptoms in diabetes like polydipsia, polyuria, and polyphagia. So here is the extreme dehydration and thirst, increased volume of urination or frequent urination, abdominal pain may be there, nausea, vomiting, blurred vision, impaired wound healing. So complication, what is the complication? It is some complication like CVS diseases, neuropathy, diabetic retinopathy may be there, and diabetic nephropathy may be there, and food damage. So if there is any kind of neuropathy, so food damage or any kind of wound may be there. So in Ayurveda, that wounds called pramya pedika. In Ayurveda, juvenile diabetes called Sahaj Pramehi. So main symptoms all symptoms will be there are from diabetes, that is correlate in Ayurveda in Sahaj Pramehi, that is juvenile diabetes. So what kinds of diagnosis may be used in the juvenile diabetes? So diagnosis is random blood sugar test or postprandial blood sugar test, or main important test is HbA1c. HbA1c. So here are some treatment. It's a according to Ayurveda, it's a anukrameya or prachsadhya. Some treatment may be there. Treatment cannot be cured completely. Treatment focus on managing the blood sugar level by administering insulin, wholesome diet, proper lifestyle, which also prevent complications. So the goal is to keep the blood sugar level as close to normal as possible. So generally, fasting blood sugar test should be between 80 to 130 mg per dl, and postprandial blood sugar test should be between 130 to 180 mmHg per dl. So, I hope that's all for this session. Genetic disorders you have understand. If you have any query, any doubt, you can ask me in below comment section. I will try to resolve your problem. So, thank you so much.